followed me for any period of time, you know that I'm really, really big on analyzing athletes' ability to hip hinge. The hip hinge is a super important movement pattern to be able to master. If you can master it, then you're loading your hips and hamstrings, your glutes, your hamstring muscles, without putting your low back in a position where it's going to be at maybe a slightly increased risk of being injured. That also means you're going to be in a more efficient position to develop force, maybe lift some more weight, be less fatigued during your workouts. So let's review how we're going to analyze the hip hinge, and then in response to an email question I had, we're going to talk about how I like to treat an improper hip hinge pattern. So I'm going to get a PVC pipe. We're going to place it along the length of my spine. It is touching my sacrum, right around my butt, my thoracic spine, my upper back, and the back of my head. I have one hand in this gap in my lower back, one hand directly behind my neck. I'm going to get a slight knee bend, and I'm not going to bend any more from here. After that, everything's coming from my hips. We're going to see how far forward we can bend while maintaining those 3 points of contact. So what I like to see is somebody being able to bend far enough forward that if I was to let go of the PVC pipe and drop their hand down, their hands would be at about knee level while still maintaining these three points of contact. If somebody can get there, then I feel pretty good that they can get into the second position or the hang position of a power clean or a power snatch while still keeping their low back in a neutral, strong, efficient position. The two most common compensations we'll see is somebody who, as they go down, they lose that neutral spine, they start to round their low back into flexion. This bottom piece will come up in somebody that's going into flexion. The other thing we'll see is somebody who hyperextends. They'll lose that middle piece because they're really overextending the low back. Neither one of those are the most efficient way to be moving. If somebody can't perform a proper hip hinge pattern, the first thing I like to do is go into a kneeling position. We're going to have the same setup, except that we're now down on our hands and knees. What this does, it puts the hamstrings on slack, so it gets rid of a little bit of the hamstring issues somebody might have. It's also going to give us a target. So I'm going to have the athlete push their hips back towards their feet. I'm going to tell them that I want you to almost sit down on your feet while letting your torso bend forward. Make sure that the athlete is getting that forward torso movement, is sitting back, and that they're not just sitting back keeping their torso upright. If that's what they're doing, we're not practicing the hip hinge, we're just doing a little knee bend. The sitting back onto the heels will really teach a lot of athletes how to shift their weight posteriorly as they hip hinge. And so if I have an athlete do 20 reps of that, maybe 1 or 2 sets, a lot of times if we go back to standing, their body's kind of learned, hey, this is how we posteriorly shift our weight when we hip hinge, and it'll fix that. If that doesn't help, then the next regression I like to go to is I'm going to get somebody down in quadruped. So we're down on our hands and knees. I'm going to usually have my hands on their back to try to cue them to keep this neutral spine. And we're just going to rock in and out as far as we can. We're not going so far down that the low back starts to round. We're really working the entire time, keeping a neutral spine. If I have to regress somebody down to the quadruped rocking, I'm going to have them work on that for a few days on their own. Then when they come back, we're going to go back to that tall kneeling hip hinge, see if that has gotten better, and then if that has, we'll try to go back up to standing. That's my typical progression for retraining the hip hinge pattern.